Hello and welcome to Athena Women's Clinic YouTube channel. I'm Dr. Kavi Prasum. Today we will talk about a topic that's affecting millions of women. It is treatable, but it's important that you recognize the symptoms and get treated appropriately. Something that is very common that can affect girls, women, older women, so generally females of any age group. Today's topic for discussion is urinary tract infections or UTI, which may affect a female at any stage or age in their life. So today we will talk about the symptoms and signs, the treatment options that are available, as well as how you can prevent UTIs. Before we delve into actual UTI, we need to understand what the urinary system is composed of. So the basic components are kidneys, which filter the blood to make urine, the ureters, which connect the kidneys to the bladder. The bladder is the organ which stores the urine, and the urethra, which is the outlet pipe to excrete the urine. Infection can occur in any part of this, so it can be kidney, ureters, bladder or urethra, but it is more common in the bladder and urethra. If the infection occurs in these areas, it can be quite uncomfortable, painful. Why is UTI more common in women? It's important that you understand that the urethra is shorter in women, which predisposes them to increased episodes of UTI in their lifetime. So what are some of the symptoms that you may experience if you're affected with UTI? So like mentioned before, the commonest organs that are involved in UTI, bladder and urethra. So you may experience pain while you're trying to pass urine. There can be blood in the urine. There can be burning sensation when you're trying to pass urine. Sometimes there can be back pain. There can be associated fever, chills, vomiting. If you're experiencing fever, chills, vomiting, that means that the infection has ascended or gone up to the kidneys, and it could be potentially serious. So you definitely need urgent attention from a healthcare professional. So what are the bacteria that can cause urinary tract infections? The most common cause is Escherichia coli or E. coli, but there can be other organisms that cause UTI, such as Enterococcus faecalis or Klebsiella. Now, some of these bacteria are what we call commensals in the gut. So the proximity of the gut to the urinary tract infection unfortunately increases the risk of urinary tract infections. What are some of the risk factors for UTI? So the risk factors: sexual activity, use of certain birth control methods, menopause, poor washroom hygiene, or systemic conditions which predispose you to UTIs. So sexual activity, how does that predispose? During sexual activity, the bacteria can be pushed into urethra, which unfortunately then leads on to the infection of the urethra as well as the bladder. If there is use of spermicides during sexual activity as a contraceptive method, sometimes they can also predispose you to increased urinary infections. Menopause, so the alteration or change in the estrogen in the woman's body reduces the submucosal tissue and the mucosa. During menopause, a woman's estrogen levels go down, which unfortunately results in vaginal mucosal thinning, which increases the risk of UTI. If a woman is struggling with diabetes mellitus or other immunocompromised situations, that can also increase the risk of urinary tract infections. So it's important to be aware of these background risk factors and therefore take appropriate steps so you can reduce the number of infections that you struggle with. How do we diagnose UTI? So dipsticks is one of the simplest forms that's available in the GP surgery or in the pharmacies as well these days. So a simple dipsticks of the urine test can tell us if you're struggling with UTI or not. But to confirm the diagnosis of UTI, a laboratory sample is essential. So we can also analyze and find out what is the appropriate antibiotic that needs to be prescribed. Depending on the bacteria that has been isolated and the culture and sensitivity results, you will be prescribed an antibiotic. It is important that you complete the whole course of antibiotic. Otherwise, the bacteria can become resistant to the antibiotics. To help with your symptoms of pain or burning sensation, it is important that you hydrate yourself with plenty of fluids. Sometimes it may be necessary to use some urinary alkalinizers to help reduce the symptoms as well. Occasionally, recurrent UTIs, which in the long term can lead to damage of the urinary tract system, may preempt us to give you oral antibiotics on a long-term basis, but in a lower dose. Prevention is the key to UTIs. So what are some of the steps that you can take to help prevent UTIs? So firstly, good washroom hygiene. So using cotton underwear and wiping from front to back will help reduce your symptoms or infection episodes. Second thing would be not to use any feminine hygiene products which are highly perfumed or scented in the area. So simple wash with water is enough. Third, increasing your probiotic intake will also help increase in the local concentration of the good bacteria, which helps reduce the infection episodes. Following the above mentioned tips would help reduce the frequency of UTIs. So, in conclusion, UTIs are quite common, but you don't have to struggle with it at all times. If you do experience any of these symptoms, please seek help from your own healthcare professional, or you can visit us at athenawomensclinic.com.au to make an appointment. Here at Athena Women's Clinic, we are always ready to help personalize your care and advice. Thank you so much for watching today's video. If you did like the video, please don't forget to give us a thumbs up and share it with your friends and subscribe to the channel as well. Thank you.